Hello everybody. Welcome to No1doctor channel. Today we will talk about one of the famous doctors. Auguste Déjerine KLUMPKE, 1859 to 1927. KLUMPKE's palsy. Madame Auguste KLUMPKE was born in San Francisco but, at an early age, her mother took her and her three sisters to Lausanne to be educated. Auguste entered the medical faculty of the University of Paris and qualified MD in 1888. While still a medical student, she read D'Herb's paper on lesions of the upper segments of the brachial plexus, and studied the consequences of injuries of the lower trunk or distal medial cord of the plexus. These might result from such accidents as clutching a ledge to break a fall or in pressure from a cervical rib, injuring the first thoracic, and sometimes also the eighth cervical segment of the brachial plexus. This part of the plexus could also be involved in birth injuries. The muscles of the hand are wasted, there is sensory loss on the ulnar side of the forearm, and there may be an associated Horner's syndrome from associated damage to the sympathetic fibers passing from the adjacent inferior cervical ganglion. Her paper was published while she was still a medical student. In the final year of her studies, she met and married a young neurologist who was also to achieve distinction, Jules Déjerine, and she took the name KLUMPKE Déjerine. She assisted her husband in his important text on the anatomy of the central nervous system. When he died in 1917, she founded a research laboratory in his memory and to carry on his work. Auguste KLUMPKE died in 1927 aged 68, having been president of the French Neurological Society and having been appointed an officer of the Legion of Honor. Thanks for watching. Hope to see you again in more next videos. With my best wishes. Dr. 8 Fahmed.